Good morning, everybody. It's Lillian here from the Health Center. This morning I'm joined by our doctor here on the nation, Dr. Ghauri. And I've asked Dr. Ghauri to come in and give you an update from his perspective. Dr. Ghauri works on our nation, but he also works at our Cold Lake Hospital. He's very involved with the region, so he can give you some regional perspective as to what's happening in our hospitals and with our healthcare system. And then we're going to be joined at the end of this by Councilor Gina, and she's going to do a community update for you as well. So just to give you a brief update on cases to date, if you remember last week when I was on here, I said we had 7 active cases. We have now gone to 17 active cases. Our region, Bonnyville MD, has increased to about 306, I believe, cases within the region, and the city of Cold Lake sits at about 150. And I do know, Dr. Ghauri, I spoke to you about that, and you said that those numbers are not true numbers.
No, unfortunately, they just take into account the people that have been tested. Unfortunately, Lillian, you and I both know that not everyone gets tested. There's some asymptomatic carriers, and so the numbers are probably a lot less than what's actually really out there.
Yes, for sure. I do know on our nation here, guys, of those 17 cases, we've got about 13 different households that are affected. Under Alberta Health Services rules right now, we are to quarantine the positive case, but on our nation, we know what works. And on our nation, we're taking a little bit more of a disciplined approach. We are asking for anybody who has contact to a positive COVID-19 case, especially if it is in your household, to please stay home and quarantine for 14 days. Monitor yourself for symptoms, and if you are symptomatic, please come for testing. What's happening in our hospitals right now, Dr. Ghauri?
So we're struggling at the moment in emergency. We have plenty of COVID cases that come in on a daily basis, and we've been dealing with quite significant cases and minor ones. However, what causes us more concern is the number of people who are attending the hospital and letting us know that they're unvaccinated. Unfortunately, due to misinformation, a lot of patients are not actually getting the vaccine, and for that reason, us as physicians and healthcare workers are having a real difficulty having to explain to patients when they do turn up that it is very limited what we can do for them. The treatments available for COVID are very limited as well, and especially if they start having difficulties with breathing, it can escalate to having to be intubated and ventilated.
So our difference in the hospital, are you seeing a difference then obviously between the non-vaccinated and how they present and the people who have had vaccinations?
Absolutely. So the vaccinated patients very rarely present because their symptoms are far milder. The patients who do attend the emergency room, by far the majority of the patients who attend the emergency room are unvaccinated individuals who present in varying levels of distress, and unfortunately, as I said, with limited treatment available, we have to kind of do our best to kind of help keep them safe and make them better again, and that is very, very difficult with the limited availability of treatments that we have right now.
For sure. One of the things that I think we need to maybe dispel right off the back is some of the disbeliefs that are out there. So I do know, in speaking with some of our band members who are currently pregnant, they are fearful of getting the vaccine. And so for our pregnant women or our breastfeeding women, what is your recommendation as a doctor?
As a physician, as an emergency physician, as a physician who works in First Nations, the most important thing I could give as a message to these ladies is go and get vaccinated. The vaccines are safe. They've been tested in pregnant women. Now, pregnant women have been getting the vaccines. The alternatives to the vaccine are actually, they're very, very disturbing, and being pregnant unfortunately does put a big stress on your body, and it can be considered to be an underlying condition when it comes to COVID. We've had cases of women who have had COVID in advanced stages delivering babies, and it being very much touch and go whether they would survive. For that reason, I have to say, and I have to urge everybody who is pregnant, in fact, I have to urge everybody, please go and get vaccinated. You may still catch COVID, but the symptoms will be so mild that you may or may not notice. And for that reason, especially with women who are pregnant, I'm more concerned of them having to do deliveries or have a child while, you know, having COVID, and that just complicates everything.
And is there a risk of preterm labor and baby complications?
I think there's multiple risks involved there. I think the biggest risk involved here is a physician, you're always taught that mum's life comes first. There are obviously complications to pregnancy, but if mum is not well, then baby will not be born well. And it will be a difficult labor and difficult childbirth.
Thank you. And I also have in our community some of our elders who have chosen not to vaccinate for whatever reason. Some of it's fear, some of it's based on past history of, vaccinations, when they were in residential schools. I really want to dispel those beliefs of, some of the more out there disbeliefs about government tracking.
Yeah, yeah. I have to say, now we've been having the vaccine. We've got to the stage now where some people are actually getting a third dose. So from that perspective, we have, in the short term and the long term, we have some data now that shows safety and efficacy. And if you look at the side effects of and the effect of COVID compared to the side effects of a vaccine, the vaccine is inherently safer. And we still don't know what the effects, and people say, oh, well, we don't know what the long-term effects of the vaccine are. Well, we don't, maybe we don't, but also what are the long-term effects of having COVID-19 infection? We already know that there's established clinics now in Alberta for long COVID. Yeah. And these are people still suffering from symptoms of catching a virus which could have been preventable with a vaccine. They were unfortunate at that time because the vaccine wasn't available. And now they're suffering the symptoms of it. And
it's systemic symptoms. It's not just, your lungs. It is.
I know people who haven't. There's a certain percentage, and I won't quote it, but there's a certain percentage of people who will never get their sense of smell back, and their quality of life is completely destroyed. There's certain people who can't walk from their car to their front door because of the lung damage that they've sustained. It's a horrible illness, and I caught COVID before the vaccines were available, and I can say that myself from personal experience. It is a horrible, horrible illness.
A lot of people are saying these are experimental vaccines. The two vaccines that we use on the nation here are the Moderna and the AstraZeneca, which are both mRNA vaccines. A lot of people are saying, the mRNA vaccines change your DNA, and I'm like, no, they don't. But what they do is they give your body a set of instructions. Am I correct?
Absolutely. mRNA is, and this kind of vaccine technology has been used before. We've already been injected with it before. It's not a new technology. People talk about an experimental vaccine because they feel it was rushed. When we had the pandemic, we had these drug companies were given a mandate, and they were told to create a vaccine without any restrictions and without any hurdles in their way. Usually if you create a vaccine, it takes years to create that vaccine, and that's because there's lots of, how can I put it, administration, there's lots of grants that you have to apply for, there's timing in between, which between part of the study then being approved and then moving on to the next stage. In this case, when this vaccine was developed, we realized that actually if we do the assessments as we go, we can get it out faster. So everyone who was involved with the vaccine was there from the start, assessing and kind of supervising the vaccine production. But this normally would take a long, arduous process, but in normal times. But during COVID times, we were able to expedite this. And therefore, it came out much sooner than a normal vaccine.
Yes, came out actually much sooner than I think any of us expected. And I think just to emphasize, that was because the world worked together on this, and researchers and drug companies worked together on this.
And we took away all restrictions and hurdles when it came to reassessment, grants, funding, which always kind of puts hurdles in the way of a vaccine being developed. And so in that case, because we didn't have any of that, we could rush the vaccine out. The technology was already there. It was a case of just implementing it with this specific virus.
Very good. The other question that I've had from several people who have called our offices is in regards to treatments for COVID.
Sure.
Dispelling some of those beliefs. I think one of the biggest ones that have come out in the last month or so has been about ivermectin, which is a horse paste for deworming your horse. It's actually an antiparasitic.
Yeah.
Can you speak to ivermectin for treatment?
Okay, so since COVID started, we started with hydroxychloroquine or Plaquenil. That was the first one that everyone wanted because that was the proven treatment for COVID. Now that's tailed off. Ivermectin was also initially touted as a treatment. And that's now gained some traction because there were some studies that people started quoting. However, if you look at the literature, those studies have been debunked and they were flawed, and there was no actual benefit from ivermectin. In fact, there are cases in the USA where patients have now turned up to the hospital, not just with COVID, but with liver failure secondary to ivermectin, which has made their survival very, very difficult. Ivermectin is not a treatment for COVID. There is no established research that is actually founded and peer-reviewed and has not been debunked on myth. That is why ivermectin is not available. People will talk about dosages and whether we can give them the human supply or the animal supply. It doesn't matter. Ivermectin is an antiparasitic. It does not work for COVID. I can categorically say that. Otherwise, we would be using it. The drugs that we are using, for example, tocilizumab and like dexamethasone is in the early stages, but the drugs, they're really, really expensive, hard to get drugs. And even so, we're using those for treatment. Trust me, I think any government in the world would rather use ivermectin because it's so cheap to use. So it wouldn't be logical if we could treat our population with ivermectin. Trust me, if it worked, all of us would be using it. But it doesn't. Unfortunately, this is why people are still dying. And that's why we're having an increasing death rate. The main reason for that, and I will say it again, is we are not all vaccinated in Alberta. And that's why it correlates with the statistics. Why is Alberta suffering so horribly with the fourth wave? The fourth wave is affecting everybody horribly here because we have a very much an unvaccinated population. I did notice that people were talking about England, where England is having a fourth wave, but England's numbers are better because they have a greater vaccinated population. So their death rate percentage is not so bad because, yes, COVID is still there and COVID is still tearing through the population. But because we have a highly vaccinated population, we're still able to stay, and they're milder and they're able to stay open and there's no lockdowns.
Yes. What about treatment with antibiotic? I have had a few people really question as to why we can't take antibiotics for this bug.
Okay.
Can you maybe answer some of those questions?
Sure. I mean, it's the age-old question. You'd go to the doctor, you have a cold, you want antibiotics. A cold, the flu, and COVID are all viruses. Viruses are not strictly treated by antibiotics. Sometimes doctors may give you antibiotics, and the only time they'll give you the antibiotics is when COVID or a virus has gone to the lungs, and they are scared that you may get a secondary bacterial infection. That is an individual physician choice, and that is the only reason in my experience that we would give an antibiotics. The mainstay that we have done, and we've tried because we are so overwhelmed, is we try and give some dexamethasone early, and I've seen that quite commonly. With a combination of an antibiotic, just so that we can stop the infected having to attend the hospital and see if we can help. Because that's what we're doing. We're trying to just help. Dexamethasone is proven to have some benefit in COVID, and so this is part of our treatment protocol with Alberta Health Services for everyone who's admitted into hospital, started on dexamethasone. Whether it has benefit in the long term, we will find out.
Okay. Some of the people that I have been case managing who are COVID positive, sometimes they try to manage at home for far too long. And I end up getting those, phone calls where people are gasping for breath.
Sure.
And so what is your piece of advice, I guess, for people who are convalescing at home? At what point do they need to seek medical attention? Sooner rather than later? I
think when breathing is affected, and when you feel like you're starting to increase, the work of breathing is increasing, I think that's when you need to seek help. The problem is with this variant, and I want this message to go out also to the public, is the problem with this variant is that we are dealing with a slightly different, in my experience so far, has been that patients end up becoming sicker sooner compared to the original COVID strain. And the Delta variant is rife in this area. It is everywhere. And all the patients we are testing right now are Delta positive. The downside of the Delta variant is that it is far more virulent, far more stronger, and how it affects patients, it seems, is that they become sicker much quicker than the original COVID strain.
Good.
So be mindful, and if you do become any feeling of shortness of breath, you need to be assessed.
Very good. So I think we've dispelled a lot of beliefs. Please, to any of you out there who have not come in to get vaccinated, I can't beg you enough to please come in and do that. Again, having those phone conversations with families when their loved ones are in failure, when they're having to make that decision to go to the hospital, those are some of the hardest conversations that I have, especially when I know that they have not been vaccinated. Please, for the love of God, please come in and get vaccinated.
I just want to add one more thing. If things get worse here, there is a possibility that there will be something called a triage protocol implemented. And a triage protocol is a last-ditch thing that we don't want to have to do, but when our ICU beds are rationed, we as physicians and healthcare workers will have to choose who gets an ICU bed by a set guidelines from Alberta Health Services. My colleagues and myself do not ever want to be in this position where we can't offer you treatment. We are already really burnt out. We are having real difficulty managing all of the patients that are coming through our emergency room because the other illnesses don't stop either. Gunshot wounds, road traffic accidents, they don't stop. When you come to the emergency room and you can't breathe and we tell you we're going to try to help you, we feel very helpless because there's very limited things that we can do for you to make you better. So all I'll ask you to do is please, 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 if you can, help us, is just to get vaccinated, because this will help you fight this infection.
Thank you. And just finally, out to all of our healthcare staff at our local hospitals, both in Cold Lake Healthcare Centre and the Bonnyville Healthcare Centre, I know how overwhelmed you are. We are starting to feel that overwhelming effect out here on the nation, just with case managing and testing and trying to make sure that we're covering all of our bases. I hope that you guys out there take care of one another. Hang in there. I hope to get through this as well as you do. Yeah. And with that, I think we'll finish off. And Dr. Ghauri, thank you for being here.
No, thank you.
And I will just take a moment break while we introduce your counselor, Gina, for a community update. Thank you. Good morning, everybody. It's Lillian here from the Health Center. This morning,
I'm vaccinated, and no, I don't know what's in it. Neither this vaccine, the ones I had as a child, nor in the hot dogs I love to eat, or gluten-free bread I eat, or in other treatments, whether it's for cancer, AIDS, or vaccines for children. I trust my doctor when she says it's needed. I also don't know what's in Advil, Tylenol, or other meds. It just cures my headaches and my pains. I don't know what's in the ink they use for tattoos or in the ingredients in my soap, toothpaste, shampoo, or deodorant. I don't know the long-term effect of cell phone use or whether or not the restaurant I ate at last week really used clean foods and washed their hands. I just know one thing. Life is short, very short. And I still want to do something other than just go to work every day, all day, or stay quarantined at home. I still want to travel, hug people without fear, find a little feeling of life like it was before. As a child, I was vaccinated for mumps, measles, rubella, polio, chickenpox, and others. My parents trusted the science, and I never had to suffer through or transmit any of those diseases. I am #vaccinated, not to please the government, but to not die from COVID. to not clutter the hospital bed if I get sick, to hug my loved ones and friends, to have to do tests to go to a restaurant or to go on holidays, to live my life, to have my kids and grandkids go back to living their best lives, for COVID-19 to be an old memory, to protect us locally and globally. You need to do your part. We need to stop this nonsense of the conspiracy theories that are killing our loved ones, that are making our loved ones suffer as we speak. Hold your breath for a minute and imagine breathing through a straw. That's how it is. It is very serious. I implore you, please go get vaccinated. We are doing everything that we can to protect you. Now, you protect yourself and you protect your children. That's what you need to do as a parent. And if you want to be a good human on this planet, do your part. Right now, we have over 350 cases in the Lakeland area. Think about it. When you're out, not wearing a mask, not washing your hands, pretending that everything is going to be okay. When you're taking up a hospital bed for somebody who needs treatment, for cancer, for their heart, whatever other ailments they have. COVID-19 has taken over, and it's up to you to make it stop. Stop the fear-mongering. Stop listening to social media. If you're going to do anything, take care of yourself. It is so important that you get vaccinated. We have 17 cases, positive cases here on our nation, and many more in Cold Lake and many more in Bonnyville. Please do your part. As of today, the band office is closed. Imagine what's going to happen with our frontline workers, our doctors and our nurses, when they no longer can treat us. They'll be determining who is going to get treated. It's getting like that. Last year, October 12th, we had over 30 cases, a huge explosion. Now, if you want to get together for October Thanksgiving, do your part, get vaccinated, create your bubbles. If you're out, don't socialize, limited numbers, stay outside. It's so important. We've been at this for the last 18 months. We know what to do. And we waited. So many people died prior to the vaccine coming out. Now we have the solution, part of the solution. It won't take COVID away, but it won't let you end up on a respirator or a ventilator or dead. Get vaccinated. There's nothing more that can be said. Do your part. If you get vaccinated and you do get COVID, it won't be that bad. But you won't die from it. We don't want you to die. We don't want anybody to die from this. But we all know people who are suffering, who have succumbed to this. And as a nation leader, part of our job is to encourage people to do their part so we can be a better nation. Let's be a better nation. Let's take care of our neighbors, our loved ones, our children, and our elders. Right now, Chief Roger is still going to be intubated for another 2 weeks. And all we can do is hope and pray. We have other nation members who've also been sent to Edmonton, and we send out prayers for their family and their loved ones, and especially all those who are battling this virus. I ask that you please go get vaccinated. Today is Monday. You call the health center, they give them 15 minutes heads up. You go in, you get the vaccination, you wait 15 minutes and you leave. Yes, you'll have some minor feelings of maybe headache and not feeling the best, but it only lasts 24 hours. 24 hours. That's all you have to give it. You don't have to wait till you have to gasp for air and breathe through a straw and look at the doctor's face, and that doctor has to determine whether he can treat you or not. Because that's what it's coming to. Within the next 2-3 weeks, we may be at even the more serious point. So please go get vaccinated. There's nothing more to say. Take care and be well. Masicho Salotine.